Touch me where you're feeling your pain.
Like right here.
All through the trap, all through that upper
and
back.
once I got to be a little bit better, it isolated. I could tell that it was actually
Right there.
here, and it's because I can't really turn left as I feel, but I can turn right.
And it's constant.
Yeah.
And you were bowling.
Yeah. Even trying to like hold myself up while I go down like that hurts.
That slow, controlled movement.
Yeah,
So that tells us that you're going to have a little rotator cuff back here. That teres major and minor right there. The minor supports the major.
Yeah, those are both just like...
You could tell they're both. If you go into the armpit, right in here, all into the back of the shoulder here, that's where we're going to start working. So that hurts to that pressure.
Yeah, absolutely.
Breathe low in your belly. And you feel like it's not so much back here.
It's definitely...
That's
yeah,
it.
There, you got it.
So on the upper trap, we have that upper trap here to here. For sure, you feel it there.
It feels good though. That's more pressure than pain. That's good.
So now we're in your rhomboid right here, and you don't feel crazy there. Definitely it's affected though. You can feel it. But that's the worst of it, you're saying right there.
Yeah, and even right there, even that's like fine.
But when I get on that section of it, that reproduces it.
Yeah, that's the pain right there.
That's the pain right there. Good. We want to be able to reproduce it. Release, relax, relax. Good. Now you're compensating on the other side, right?
Yeah, I can tell.
We're going to come over to this side. It even looks a little swollen after I've worked on it.
Yeah.
You dug it out with the ball, with a lacrosse ball, but you did it the moment it started hurting almost, the day it started hurting.
Well,
and then it felt like it was too much. Yep.
And I couldn't do too much.
When you have an injury like this, that first day and second day, you're in that acute inflammatory process. Everything's inflamed, everything's irritated. You're getting all this inflammatory markers that are dumping all this collagen and inflammation to help repair the tears that you had in your trap, okay? So having some inflammation in the beginning is very important in the healing process. So I always tell people, let something hang out for a couple hours before typically you ice it down real good. Now, of course, if it's a trauma, if it's a head contusion, you have to ice immediately. But this right here, this is a muscle tear. You strained your upper trap.
Okay.
And the levator scapula that goes to the corner of your shoulder blade here and up into your neck. In the very beginning, it's more about icing.
Yeah. So
give yourself that couple hours and then ice it down, all right? The next day, I'd say you can do some light digging with like a 3 out of 10 with pressure. Okay. And you're just trying to isolate where it is, like what I've been doing with my thumb, right? See, I'm kind of finding it all locked up in here, really here, but it released a little bit, so that tells me you're well hydrated, even in this heat, so good job. Keep taking your electrolytes, okay?
Yeah, I've been doing that for sure.
Breathe in your belly. Find your Kegel. Now get the lat moving on the side, because how do we turn off the upper trap and the rhomboids? We get the latissimus dorsi on the side
to connect on that.
To connect to your core. So you take the pressure out of this. It's that idea of, how do I turn off my bicep? I flex my tricep lightly. How are you going to turn off your traps and the posterior rotator cuff here? You're going to lightly flex your lats. Now let it all go with your breath. Too much of a good thing is a bad thing. So you can see how you're turning red already. This is the latissimus dorsi here into the core. This is the minor. You can feel the major is much more involved here. And that's your infraspinatus. Infra, teres major, teres minor. And it stops right in here. So you're digging all this area out at home. Now when you do deep tissue in the beginning and you strain something, you are going to feel worse every time.
I went through that learning experience.
Yeah, like coming in and getting adjusted. Your first couple visits, you're going to be very sore until we get that poison, that lactic acid out of the muscle. A little bit's okay, but a lot, it really irritates the surrounding muscles in our nervous system, so you'll feel it. Let it all go. 3, 2, 1, drop. There it was, buddy. So we've moved all 3 ribs now. So at least make you feel like you can move your shoulders again without feeling like it's taking your breath away or whatever that feeling is for you. This muscle's like your shirt. See how it's going to pull your ribs out of place? Yeah. So to keep these ribs in place, you have to dig out here in this posterior rotator cuff and all through here.
Gotcha.
But if this is going to release, that means you have to work on the chest as well. We put our arm behind us onto the low part of our back on the right side, and we dig out all of our pec because we want to loosen up the pec to bring the shoulder back. I always feel like this is the cause. These are the compensators. Why will the compensators stop until you address the cause?
So I need to roll my pec.
You have to roll your pectoralis major and minor. That's what probably pulled everything out and made these compensate. Remember the upper cross syndrome? Your job makes you roll your shoulder forward all the time.
Yeah.
Your mouse hand is on the right hand.
Uh-huh.
Well, that means that this is dumped forward all day with your pec firing, and then this muscle and this muscle is compensating, okay? Then your brain connects to that. Then you went bowling and started throwing the ball, and that's when we got all that issue, all that muscle response. Now that we loosen everything up, let's adjust you. Let it all out. Loose.
Oh man.
You good?
Uh-huh.
Good. Breathe low in your belly. All out. That's good. Breathe easy. All out. That's the one.
That was good.
Good. I want you to look your head up easy. Up at the door. Yep, now relax. Good. Breathe low. All out. Let go. Good. Not bad. The fact that you're moving tells us, once again, you're pretty hydrated. Breathe low. All out. And one more time. All out. Loosen. Let go.
Thank you. Oh man.
That's gonna help a lot.
Yeah. That's like what I've wanted for like the last 2 days.
So glad you came in, man.
For sure.
Breathe. All out. Loosen. Let go. You okay with that?
Yeah, I'm good.
Cross our arms. Now pull your shoulders down a little and breathe low. All out. You okay?
Yeah.
Just sore.
Yeah.
I want you icing 3 times today.
Okay.
As soon as you can even do it before you leave, right? And then as soon as you get home and 1 time before bed.
Okay.
Before bed, you're going to do light stretching.
Okay.
No more deep tissue today.
No more rolling?
Yeah, I wouldn't.
Okay.
Good. Bend this knee up. Yes. Breathe in your belly. All out. One more time. Deep breath. All out. Yep.
Oh, yeah.
You needed this one.
Yeah.
Bring here. Pull here. Good. Lift all the way up. All out. Loosen. Telling you, doesn't get much better than that, buddy. Making me look good. So you have these muscles here on the side called your scalenes, okay? Back here is your trap. See how your trap comes up into the base of your skull here?
Mm-hmm.
Well, if you go a little bit more down from this corner, you'll see deep right in there. That's your levator scapula. Feel that one?
Wow. I can feel on the other side when you're doing that one.
When you're working on yourself with a ball, a lacrosse ball, doing deep tissue, right? It's like you're peeling away layers of an onion. You're slowly unwinding that fascia and the scar tissue from all of our repetitive injuries. What's the cause of all these repetitive injuries? Poor posture. Anterior head carriage, rolling your shoulders forward, right?
Yeah.
No one's perfect, but how often are you checking in throughout your work day? Because you know you got to go bowling tonight. Well, not this week, hopefully. If you do what we're talking about, where you dig it, you stretch it, and then you ice it, which is treating the old issue, the old injury that you caused, bowling, right?
Mm-hmm.
And then you walk through your day, breathing in your belly, finding your Kegel, pulling your shoulders, getting the head to the horizon, and tucking your chin. Now you're correcting the common cause, which is that poor posture. You're preventing the injury from happening. So treat your old, dig, stretch, ice, have good posture, and prevent the new. If you really focus on all that this week, I'm telling you, we'll be able to get ahead of it, because you slouched too much at work and you made your pec way too tight. See what I'm saying? These are tight. Your pec minors are tight. That's what's pulling everything forward.
Man.
You get what I mean?
So I hadn't had rolling my pecs in my like routine.
You absolutely
So-
should. Yep, so your hands behind your back and it exposes your chest. So you work all the way around, you stay away from the nipple, but you work from this corner all the way in here. Both sides. Full. Got you. Let it go. Money. Let you stretch. We're gonna go a little higher up here. I've already moved most of it earlier. I'm checking your atlas. Right. Ooh. That was really good. Thank you, my friend. Let's help you up. But to get up, you got to use the right muscle groups. You're going to breathe. Give me your hands. Find your Kegel. Pull your shoulders. Tuck your chin. That's my boy. That's how you're bowling, too. You're going to get locked and loaded. I'll let you get ready. You're going to breathe, Kegel. Pull it back, right? Then you're going to go, right? I'm not pulling it with my shoulders forward. I'm pulling it with my lats back. Same thing with my golf swing. I'm going to pull it back. Then I'm going to bring it back.